There are a few stages in the IVF process, and one of them involves retrieving a patient's eggs or oocytes so that the eggs can then be fertilized. And that's what we're talking about today on Lunchtime Live at the Center. Dr. Reeva Makijani is back with us to talk about egg retrievals. Dr. Makijani, welcome back.
Hi, thanks for having me.
Sure. Can you talk about what it means? What does egg retrieval even mean?
Sure, yeah. So um, once a patient goes through an IVF cycle, eventually we have to retrieve the eggs or remove the eggs from the ovaries in order for our lab to fertilize them and then create embryos. So the process of extracting the eggs from the ovaries is called an egg retrieval.
Okay. And about when in a cycle does this happen?
I'd say the earliest it happens is 11 days after the start of injections, but it can range. It can also happen, I would say, 16 or 17 days after the start of injections, depending on how an individual patient responds. So I'd say ballpark about 2 weeks after the start of a cycle.
And is that also, so does the injections coincide? Do the injections coincide with a period?
Um, Yes, in a sense. There are different protocols for IVF, but typically, in all IVF cycles, there are injections that a patient takes to stimulate the ovaries, and that portion of it generally begins with the onset of a period.
Okay. And how do you determine, so you said between 11 and 17 days, how do you determine when it's time to retrieve?
Yeah, so that is when a patient's doing an IVF cycle, we monitor them with blood work and ultrasound to see how their eggs are growing. And then we have different criteria in terms of the number of eggs and their size, which we use to determine when a patient should be triggered. Being triggered means that we administer a medication that starts the process of ovulation and egg maturation. And after a patient is triggered, about a day and a half later, we do the egg retrieval. So it depends on the size and the number of follicles.
And that is monitored through
Ultrasound and blood work.
Okay. Would a patient and their partner need to abstain during the time leading up to the retrieval?
Yeah, that's a great question. So I advise patients to stop having intercourse midway through their stimulation because the ovaries, that's when the ovaries start to really get larger in size, and there's a risk of something called ovarian torsion, where the ovaries can twist in response to any sort of force or trauma. But early in the cycle, they can still have intercourse, but I still recommend protection because we don't want them to get pregnant while they're undergoing IVF stimulation.
Okay. And once you've determined that it's time to retrieve, what is the process leading up to the actual retrieval day?
Yeah. So once they've been triggered, so the patient takes the medication that will start the process of egg maturation and ovulation. The retrieval occurs 35 hours later. So what typically happens then is the following day after the trigger, the patient comes in for blood work. And that blood work, the purpose is to make sure they responded to the trigger. And then our nurses would call the patient with time of when they should arrive to our center for their egg retrieval the day after that. But there's really not much more that happens between trigger and the retrieval.
Okay. And so the retrieval happens we have many locations, so where exactly would it happen?
Yeah, so regardless of which of our locations you typically go to, whether it's Brantford or Hartford or Farmington, all retrievals happen at our location in Farmington because that is where our OR is, as well as our IVF lab and embryologists.
Okay. And so with the IUI, some of the nurses can perform that, but who performs the egg retrieval?
Yeah, so the egg retrieval is a little bit more involved than IUI. It is a small surgical procedure, but it is a surgery. So a physician will perform that procedure, but patients should know that, you know, it's a little bit unpredictable exactly when they'll be ready for the retrieval. And in our physician group, we all take turns covering the procedures on sort of a rotating schedule. So any one of us may be performing the egg retrieval on a given day.
Okay. And can you talk a little bit about how it's done?
Yeah. So it's a 20-minute procedure, very safe and quick. Uh, and there are no incisions. The way we do it is we actually insert a fine needle through the vaginal walls into the ovary under ultrasound guidance. And we are able to basically drain the fluid from the follicles. The follicles are the cysts in which the eggs are in.
Hmm.
And we give the fluid over to our embryologists who look at it under a microscope and can select the eggs out.
And so if there's a fine needle, is there sedation or
Yep.
do
So
they feel it?
we do our egg retrievals under IV sedation, propofol and fentanyl, so patients don't feel any discomfort during the actual procedure. And most of them, I mean, the vast majority, are quite comfortable afterwards, and most go back to work the following day.
Okay, so they would need to take the day off, you would say, to rest?
Yes, absolutely. Just because we do give IV sedation, we recommend that they do not work or drive on the day of the procedure, but they are absolutely okay to return to work the following day.
Okay. So you said before that the procedure takes about 20 minutes and then they go home, they rest, and they can go back to normal activity the day after?
Yeah, normal activity with the caveat that the ovaries are still enlarged, so they should still probably avoid intercourse or any like high impact exercise, running until they, um, depending on what their plan is, they get their period or their physician states that it's okay to go back to some form of exercise.
Okay. And does a patient need to have someone with them during this procedure?
Yes, they need someone to drive them home, absolutely. And then they need someone with them for the rest of the day, just in the rare case that there is some kind of issue. They shouldn't be alone that day.
Okay. And what type of risks are associated with egg retrievals?
So with like any procedure, there are risks, but the chance of complication is exceedingly low, less than 1%. But some of the risks, since we are putting a fine needle into the abdomen, there's a risk of bleeding. There's an extremely low risk of infection. And of course, there's also the risk of injuring an organ nearby, like the bowel
Mhm.
or a major blood vessel. But again, I mean, the risk of complications with egg retrieval is very low.
And is there typically any pain associated with it?
Not because we give sedation, not during the procedure, but afterwards you may feel a little bit crampy,
Mhm.
but Typically, it's mild, if patients can take Tylenol afterwards. We also give some additional pain medication in our recovery room if necessary, and that's often more than enough. And again, most people feel pretty normal the following day.
Okay. And when do you give information as to the, I'm sure patients are wondering how many eggs
Yeah.
were retrieved during the procedure.
Yeah, so we do tell patients right after the retrieval how many eggs were retrieved, but the important thing to know is that doesn't mean that every single egg we retrieved was mature, and that does not mean that all of them will fertilize. So the following day, they'll receive another phone call with that information. But it's not expected that every single egg is mature and every single egg fertilizes.
Okay. So there's communication then and thereafter as well.
Absolutely, yeah.
And what happens to the eggs once they're retrieved?
Once the eggs are retrieved, they're in fluid. The fluid gets given to the embryologist, who then isolate the eggs into a separate dish.
Hmm.
Um, the eggs then rest for some time, and then they get fertilized. It either can get frozen if a patient is doing egg freezing, or if the plan is to create embryos, then they will get fertilized with sperm.
Okay, so it just depends on what's the situation with the
Yeah,
patient and
exactly.
between the patient and the doctor, and if you're egg freezing at that point, the eggs will be frozen.
Yep, yep, and often on the same day, our embryologist will call the patient and let them know how many eggs were frozen.
Excellent. All right. Well, thank you very much for joining me today.
Yeah, great, no problem.
Yeah, and thank you for watching. If you have any additional information, if you have any questions, feel free to visit our website at uconfertility.com. There's a phone number there as well if you need to reach us. And we'll see you next time on Lunchtime Live at the Center. Bye for now.
Bye.